Okay, so your period is late, and your mind is probably racing with one big question, right? Am I pregnant? It's a totally valid concern, but it's often not the whole story. In this explainer, we're going to unpack why your cycle might be delayed. Let's get right into it.
I mean, this is where everyone's mind goes first, isn't it? And for good reason. A late period is one of the most classic early signs of pregnancy, so it makes perfect sense that this is top of mind.
But here's the thing. While pregnancy is definitely a possibility, it is far from the only explanation. So we're going to explore the many other common, everyday reasons why your cycle might be a little off schedule.
To really get why your period can be late, we first need to appreciate the system behind it all. It's not just some simple timer that goes off every month, it's an incredibly complex and sensitive biological process.
Think of your menstrual cycle as a conversation happening inside your body, and it's all orchestrated by hormones. The entire point of this whole process is to prepare for a potential pregnancy every single month, so any little disruption to that hormonal chat can cause delays.
Yeah, we all hear about the perfect 28-day cycle, but honestly, the truth is, normal has a super wide range. Fluctuations of a few days here and there are incredibly common and totally expected, especially at different points in your life.
So if it's not pregnancy, what are the most common culprits? Well, let's start with the stuff that's just part of everyday life. We're talking about stress and changes to your routine.
Now, what's really interesting when you look at this list is just how, normal these things are. Emotional stress from work, a really intense workout, not getting enough sleep. These can all send tiny signals to your brain to maybe delay ovulation. And if ovulation is delayed, your period will be too. Simple as that.
And this quote just hits the nail on the head. Everybody and every body is different. You might find that your cycle gets thrown off by one stressful week, while your friend might go through the same thing and not notice any change at all. It's all about your own individual sensitivity.
Okay, so beyond daily stress, there are other pretty significant hormonal events and health factors that can play a role. Let's broaden our investigation a little bit.
So here's the crucial difference. A general cycle shift is usually because of a temporary disruption, something that just delays ovulation. Pregnancy, on the other hand, involves a brand new hormone, HCG, which actively tells your body to stop the cycle in order to protect the pregnancy. Two very different messages.
And of course, there are a few other things to consider. For example, if you've just stopped taking the pill, it can take your body a few months to get back into its own rhythm. Also, conditions like thyroid issues or other hormonal imbalances can cause irregular periods. These are less common for sure, but they're important to keep in mind if the irregularity keeps happening.
Okay, I know that's a lot of information. So the big question now is, what do you actually do? Let's walk through a clear, simple plan to help you figure out your next steps. First things first, just remember this. A single late period is just one piece of data. It's a really important signal from your body, for sure, but it doesn't tell the whole story on its own. You need a little more context.
So here is a really practical three-step approach. Step 1, just start by observing your body. Are there any other symptoms? Pay attention. Step 2, you could use a structured online check just for some initial orientation. It's not a diagnosis, but it can help you organize your thoughts. And finally, for a definitive answer, step 3 is where you get certainty. Nothing beats a home pregnancy test or a conversation with your doctor.
When you boil it all down, it comes to this. A late period is your body trying to communicate with you. Learning to interpret these signals is such a powerful tool. Whether it's stress, or a change in your routine, or something else entirely. The real takeaway isn't just about finding an answer for today. It's about understanding your body better for the long haul.